Hi everyone. So I wanted to explore some movement with you today because it's a huge part of what I do, it's a huge part of who I am. And in the piece that this video sits within, the writing piece, I've talked about the energetic and perhaps ancestral things that I believe happen in my personal body, that I use things like massage and essential oils and journaling and all of those things to kind of explore and hopefully to eventually release. But also that I am aware that the pain that I'm feeling I can make better with really practical things like movement. So they're two very separate pieces. Some of you will really connect into movement, some of you will really connect into the holistic side. Some of you will think that I've got, I'm talking some truth with both things. But I just thought I'd explore three movements that I do most of the time, just to really help create a little bit of space and ease my pain in my body. So a lot of my pain comes down the right side. I know I've got really tight glutes on the right side. I know I naturally drop into this hip and compress down on the right side here. To you it'll look like the left as well, I think, because it's the video. And also I carry my little girl most of the time on this side. So it causes that dip. Now the first thing that I really like to do or really enjoy doing to create a little bit of space is coming into a 90-90 position. So I'll quite often sit with my left leg forward and my right leg back. That's the one that I find the most easiest to accommodate. And then I put my left hand down on the floor. I take a big breath in and reach my right arm up. I try and keep my sit bones grounded, so both bony bits in my bottom are pushing into the floor. They don't really move. If I had like a spirit level in between my hips, the bubble would be right around my tummy button. So I'm lifting up and then I'm hinging over. Now that automatically creates space in the right side, but what I also know is that I hold a lot of tension in the back of that right side. So actually if I roll my shoulder forwards a little bit, and particularly if I turn my chin down towards the floor, I can really feel that pulling round to the back. Then I use a diaphragmatic breath. So you take a breath in, then you need to take a full exhale out. So you keep going, ideally through the mouth with a sound until you can't breathe out anymore. All the breath is gone. Once you've done that, you then almost hold on to that lower belly button with that squeezing in that you get at the end of the exhale, and inhale with the intention of breathing into the back of the rib cage. Then you take another full exhale again through the mouth, emptying through the lungs, feeling almost the hip bones pulling towards each other at the very end, which switches on the lower abdominals. Keep that squeeze at the bottom of the abdominals. Inhale. Keep inhaling. Release the squeeze at the bottom of the abdominals. You'll feel this huge, beautiful stretch through the right side. And then another really long exhale. Keep going till there's no breath left. Nice big stretch. And then I always pull the shoulder back first and maybe look underneath my armpit before I bring myself back round. So I can automatically feel, and you can see when my left leg is a bit more forwards that my left shoulder wants to drop. So it does naturally create that little bit more space in the right side. I used to sit like this a lot in pregnancy as well, because it used to alleviate that little bit of pressure there. The other thing that I like to do, and I do this on both sides depending on where I can feel the most tension, is what we call a hip shift. So I'm going to try and show you this sideways but also from the back so that hopefully you can see what happens. But you come into a 4-point kneeling position and you want to put the block right underneath your right leg. Now you need to keep your right hip and your right knee really level with each other, so like a tower, a stack. You rock the tailbone back, so you also want to make sure you've got a flat back, so your gaze needs to be down towards the floor. And if you do have a big curve in your spine, it might be just a case of just tucking the tailbone a little bit. You then shift the weight back and then tuck the tailbone. Now some of you here, so I am really tight here and I fell on my coccyx a few days ago, so this is really tight. I can feel this lengthening through this middle bit of the glute here. But if you don't feel very much here, what you could do is tuck a little bit more. You could take a deep breath in, and then as you exhale, you can start to, keeping this side completely stacked, you can start to pull that the left side, the left hip up towards the sky. and then you might rock back a little, tuck a little bit more, and then I can really feel this like right underneath my bum. This is really great for releasing sciatic pain as well. So you could hang out here and just breathe. Now I've got my left foot on the floor because I find it easier, but you could lift the left toes off the floor. And again, you're finding that diaphragmatic breath. So inhaling first, nice long exhale, feeling the lungs completely empty. Imagine that you're trying to pull those hip bones together with the very last bit of breath. Hold on to that just for the first part of your inhale, which shifts pressure, breath, oxygen up into the lungs, so it helps with any pelvic floor dysfunction. Then allow that bottom bit of the abdominals to go as you inhale. It softens, everything expands, and then you find that nice long exhale. So yeah, that's really opened out that right side for me, and it feels really beautiful. Now, the other thing that I like to do is use a tennis ball or a massage ball and just place it right in that fleshy bit of my bottom, and you can have a little bit of a wriggle. So sometimes it feels really good to come more onto the outside of my right hip, sometimes it feels really good to go right next to the sacral area, and all I do is put that underneath my bottom. My right leg is always straight, and then I have a little bit of a roll forwards and a roll backwards and a little bit of a roll from side to side, and where it feels tender and stiff, I'll pause, and again I'll find that diaphragmatic breath. So it's about taking an inhale, finding that complete exhale, so emptying from the ribs. Keep going till there's nothing left, and you might feel those lower abdominals pull in. You just keep that tension just for the first part of the inhale, which redirects the pressure of the breath up into the back space so that you're softening those muscles that are all tight around the back. Then allow that bottom bit to soften so you can get a full breath in, and then find your exhale again. And you could do that for around about 5 minutes, just gently moving through with a tennis ball. You could also do it on a wall. So put the tennis ball on the wall and give it a little massage with your bottom as well. Or you can get massage balls. So I really enjoy a hard massage ball over a spiky one. I don't feel as though the spiky ones quite hit the pain point quite where I need them to. So that's really 3 really simple things. In terms of the side stretch, I would probably do 5 breaths worth and then have a rest, go back and do that 2 more times, so 3 lots of 5 breaths in total. With the hip shifts, I try and do those in the morning and I try and do those in the evening as well, because it really does help. It's probably, that hip shift has probably been the most relieving for me in terms of any of the symptoms that I have, but it did take me a really long time to master it and to feel it where I was meant to, partly because I needed to work out how I was breathing and get that diaphragmatic breath nailed properly, but also just because I needed to really explore that tuck of the tailbone and which bit I was trying to lengthen. So sometimes, and when I work with women in class, that sometimes takes a little bit of tuition, and sometimes it's a few weeks before they're like, aha, I feel it, I get it. And then the tennis ball massage, again, as much as you can, ideally 3 times a day, morning, lunchtime, and at the end of the day. And again, that's the one that I would advise that anybody can do, because you can't do it wrong. You can really feel it in your body, but it's definitely going to help you become more aware of exactly where the tension sits in the muscle, and then give you the opportunity to really work with it, and you'll see a difference. So I prescribed this movement to one of my clients 2 weeks ago, and she's already feeling a really big shift in terms of the amount of pain that she's experiencing in her hips and in her knee too. So it does make quite a big difference. It's quite a good one to do. So yes, that's the movement side. I believe that if we're not working with that energetic side, the deeper muscle fascia, and all of the things that come with that nervous system regulation piece, I believe if we're not working with that as well, no matter how much movement we do, whenever we stop doing that movement because of time restraints or because we're not well, that pain is going to creep back in. Now, I'm a work in progress. I still have pain, but it's definitely shifted over the years. It used to be really chronic in my when I was at university, and it's definitely become less as I've kind of moved into this mothering part of life, and also because become really connected to my body, and also more of that kind of spiritual ancestral trauma that I think is holding in my body. So I hope you found that useful. I have a couple of courses where I do some of those movements and I go into quite a lot more detail. So one of them is birth biomechanics, because these are really quite useful things if you're pregnant, to help create space in the pelvis. Another one of them is all about the pelvic floor and how you can find simple movements that are going to release the pressure in the body that takes the tension out of the pelvic floor, because that's quite often why we have a lot of leaking and dysfunction. So they're two of the courses that you could access, and they're all on my website, so I'll pop the link to the website in there so that you can have a look at those courses if you're interested. And I would love to know if you resonate with anything that I said about muscle, fascia and tissue holding on to the ancestral trauma. I'd also love to know if you try some of these movements and if they help and make a difference for you, or if you have any questions. I am absolutely here to help. It's one of the best things about my job. I love to kind of help people with the pain that they're experiencing, and hopefully make that day-to-day life just a little bit easier to manage. Thank you very much for tuning in, and I will see you all again soon. Take care.